From the WDXY studios in historic downtown Sumter, At Your Service Home Care presents Medical Forum with moderator Jeff Reed.
Good morning. Welcome to this early Saturday morning. I'm your host, Jeff Reed, with my co-host, Chris Marr. We have our little show called Medical Forum. Been doing it for, I don't know what, Chris, 10 months?
Just like about, that. Yeah, back started in March.
Yeah. And talk about all medical issues. Today's going to be a great show. We're going to have three great guests from Carolina Diabetes, Dr. Lily Vivat, Amber Stoudemire, and Dr. Baez. And we're going to talk about something that they've got coming on later this afternoon, where I hope a lot of people attend. It's always a great attended fair that they have over at Wilson Hall. But Chris, last week, I always enjoy having reliable medical.
Yeah, I enjoy having Martha Joe and Aubrey on telling us about, we talked about some oxygen and CPAP, sleep apnea.
I learned a lot.
Absolutely. It's such an evolving field. Lots of new things, cutting-edge technologies coming up for treatment. Not only treatment, but diagnosis, making diagnosis a little bit easier.
Well, and I mean the severity of compliance. You know, people that don't comply, you're talking about going to sleep and stop breathing.
Yeah, absolutely.
Can cause death.
The equipment's gotten easier to use. It's smaller. It's portable. You take it on vacation with you. Not a big deal. But at any rate, go over and see Aubrey over at Reliable for any questions you have with your CPAP equipment, any concerns. And again, we talked about staying local. You know, get your CPAP equipment in Sumter. If you one of the reputable DME companies in Sumter to get your equipment. So if there's a problem, need it fitted, need mask adjustments, changing the mask types, it's local.
Right.
It's easy to take care of.
Well, and you talk all the time about medical equipment that we see, specifically knee braces, elbow braces, all the fly-by-night TV. You know, coming from Florida, and we're going to ship you a knee brace, and somehow it's specifically going to fit you. And
I saw one this morning. I had
use your shredder on
one
those.
Come in.
You?
I do. Yeah.
Okay.
And I said, call the patient and see if they wanted that knee brace. And the patient said, well, I didn't order a knee brace. Kind of interesting. I got an order for the knee brace, and patient had no clue.
Yeah.
So, you have to watch out for those things. If you're a Medicare patient, there's a lot of fraud in the system, and not necessarily fraud, but there's just a lot of solicitation of unnecessary medical equipment. So do your due diligence, see your physician,
Absolutely.
Make sure it's the right equipment for you, and use a reliable.
I like that word.
You like that word? A reliable company.
I like that.
That was spontaneous.
And if you're really colonial, you'll do that. You like that? You like that?
Excellent. That was spontaneous, believe it or not.
Well, speaking of local, I always want to give shout-outs to our sponsors, Bynum Insurance. Go see them, 1170 Wilson Hall Road, Karen Schwartz. Right now, it's a pivotal time for anyone looking at Medicare with all the enrollment time, and time is of essence. I think if you're 65 or older, you have, I believe, till December 15th, and that's starting November. So that's a big time to see her, and she will, as we've talked about, make life so much easier, and it doesn't cost you anything. So what an added value.
For the Medicare plans, Karen's versed at what local physicians are taking those insurances. So again, you don't want to go buy a plan that no local physician takes or accepts the insurance. Also, those Medicare Part D plans, make sure that if you need drug coverage, absolutely, the pharmacy coverage. If you need drug coverage, sign up for a Medicare Part D plan. If you don't and you defer that, remember there's a penalty down the road if you decide to take it later on.
And if you own a business, depending on the amount of people you have, as Karen's told us, that can be a penalty for your employees as well. And I want to thank Toomey Home Health Systems. Two things to remember with that. One, the golf tournament, which we talked about on a few. I am not a defending champion anymore, so we'll just leave it at that.
So how are they able to get your name off of that trophy? Because I figured they engraved your name before. They put a Jeff or a Jeff.
We're going to edit all this out. But no, we played okay. We finished in the middle of the pack, so congratulations to the people that obviously cheated. The other thing that we want to talk about is with the Christmas trees coming up. Support the hospice. It's beautiful in the hospital. I know with Dr. Lily Vivat here, he's at the hospital a lot, and there's no better time to be at Toomey, and I think it's beautiful to see the trees. It's a great sponsorship if you're a business. You can either sponsor it or you can decorate it, and it really adds
or
to people.
Both.
Or both.
Kim Price will take care of that.
Kim Price
She's
will do
being
that.
fitted for her harness at this point to as she dangles over the Christmas trees.
December 3rd, the lighting of the big tree, Chris.
Absolutely.
And Reliable Medical, we've talked about. Thank you to them. AYS, of course, our presenting sponsor at your home service, and Tri-County Home Health. So we've got some great sponsors. Go by and see them. Tri-County offers you DME, also home health and hospice. We preach about staying local. Probably a staple in the community is our guest today. The Carolina Diabetes and Kidney Center. We have Amber. Amber, thank you for coming.
Thank you for having us.
Now, I heard you on Derek Burris' show.
Yes.
Talking about what we're going to talk about today.
Mm-hmm.
All right, so we're going to reiterate. And I mean, this is big because it's going to happen in a couple hours. So I'm sure you guys got a busy day. Dr. Baez?
Yes. Hi, good morning. My name is Dr. Aileen Baez. I've been with the Carolina Diabetes and Kidney Center for about a year now. I am a pediatric endocrinologist, so I take care of children with type 1 and type 2 diabetes, and I'm very excited to be here today.
Well, thank you for coming in, Dr. Louis Vivat. Obviously a staple in the community, yourself and the lovely Dr. Shishinda.
Thank you. It's a pleasure to be here this morning. Yes, this is a great day. Today's November 14th. It's a World Diabetes Day.
This is why we're here.
That's why we're here. Yes. Why the World Health Organization and the International Federation for Diabetes, they declare November 14th as World Diabetes Day because it's so important that we should be all aware of that.
Well, with diabetes, and maybe what we do as we probably have a minute left in this segment, minute and a half, is to talk about your backgrounds. Amber, real quickly, how long have you been? Dr. Baez, you've covered on yours very adequately, that's for sure. Amber, how long have you been with the company? What's your role with Carolina?
I am the public relations coordinator, and I also recruit the physicians to our practice. I've been there for about 3 years now. I'm from Columbia, South Carolina, and I graduated from the University of South Carolina.
Very good. And for those, the practice, and we're going to talk about that in our second segment, just how it's grown and all the specialties that you do, from dialysis to obviously with pediatrics. And we'll talk about maybe to our audience out there the difference between diabetes type 1, type 2. And then we want to certainly get to the fair that's coming up and what we can expect there, what the people that have attended. It's just a tremendous fair that you've had 19 years in the makings. So as we shoot out of here on this first segment, want to again thank our presenting sponsor at your service, Home Care, 803-607-9677 locally. As we always preach, 1250 Wilson Hall Road. As we come up on Thanksgiving and Christmas and might need a little help with elder people to bring them home, they have great CNAs that'll take care of them, whether you're bringing them home for a great Thanksgiving meal or taking care of them as you travel. So as we come up on our first break, again, we're here with Carolina Diabetes and Kidney Center. Going to learn all about diabetes and the great 19th annual fair. Coming right back. Thank you.
Back with the latest in health and medical news on Medical Forum, presented by At Your Service Home Care, WDXY 1240 AM and 105.9 FM.
Here's a good policy from Bynum Insurance and Auto Owners Insurance. When you buy home and car insurance, you'll receive a multi-policy discount. And when you buy life insurance, you'll get a special discount on your home and car insurance. Auto Owners will save you money on all of the insurance you already have. Now that's good policy. This is Sandy Wilson with Bynum Insurance. Call me for all your insurance needs at 803-469-3030.
After my surgery, I heard my children discussing their fear for me to live alone. I wasn't ready to give up my home and freedom, so I called At Your Service Home Care, and now I have my own concierge. It's owned locally by medical professionals. They work with me to make sure that I recovered from my surgery. Now I can stay at home and I have a new friend that I enjoy spending time with. If I need help around the house or have insurance or legal questions or just getting to my hairdresser, they help me with it all. Call At Your Service today for your free consultation, 607-9677.
Reliable Medical Equipment has been locally owned and operated since 1999 and provides a full range of medical equipment and services. Our accredited facility has a fully certified staff, and we are here to assist you with all your diabetic shoe, custom bracing, and prosthetic needs. We accept Medicare, Medicaid, TRICARE, and most private insurances. We're located at 246 Broad Street. Call 934-9212 or 435-9927 for our Manning location, which is at 37 West Rigby Street. Voted Best Prosthetic and Orthotic Business for 7 years.
The doctor will see you now.
Are you new to Sumter or been here a while and in need of a new family health care provider? Look no further than the excellent care provided by the physicians and staff at Carolina Family Medicine. Carolina Family Medicine includes Dr. Philip Jansen and Dr. Tracy Ridgel, who both specialize in family medicine. And they're here to take care of you and your family, now accepting new patients. So call them today to schedule your appointment at 774-7425 or find out more at cfmsumter.com.
The doctor will see you now.
This is Medical Forum, presented by At Your Service Home Care.
And we're back with Medical Forum on this Saturday morning, November 14th. Remember that if you've missed any part of this show today, you want to listen to some of the segments, we re-air on Sunday at 2 o'clock. We're here today with Carolina Diabetes. And interesting fact I learned at the break, that this today is National Diabetes Day. This was established by the World Health Organization in 2002, and just really to bring about the need for understanding of diabetes and how endemic this is in our population, right?
That's right. Correct. It's so important that we need to be all aware of that. And currently in our country, we have 29 million people that have diabetes, but it's only 21 million that have been diagnosed. So there's still about 8.1 million out there that have diabetes, but they don't know about it.
Wow.
That have not been diagnosed.
Well, let's talk about that. Let's say that let's talk about a general maybe characteristic of what diabetes, as an owner of Reliable Medical Equipment, our diabetes patients, unfortunately, are predominantly our artificial limb patients. So they lose, from a neuropathy standpoint, numbness. What if I'm listening and I'm hearing going, that's interesting you say that, I might not be diagnosed for diabetes. Wow, that kind of scares me. What are some of the symptoms, Dr. Lodevivan?
Unfortunately, many people with diabetes have no symptoms.
Okay.
Yeah. Classically, the symptom that they would have frequent urination. They may get up at night, go to the bathroom. They may have thirst. They would drink more water. So those are classical symptoms. However, there are many, many people that have absolutely no symptom until they're really sick, end up in an emergency room with complications.
Wow.
I think that that's one of the importance of the National Diabetes Awareness Day. We're seeing a trend in that, in the sense that there's Breast Cancer Awareness Day. There's all these different awareness days, because we want to make sure that people either know the symptoms about, regarding diabetes, but those that don't have symptoms, like we said, most people do not have the symptoms. You need to be getting checked. You need to be getting screened, especially if you have a family history of it. It's very important. Most people end up getting diagnosed and already have these complications. You mentioned the limbs. We're talking about kidney. Mm-hmm. Most people already have the development of some complication. It's 2015. There's no need for that. We really need to get people to get their health care at an earlier date than that.
Well, Dr. Marr, you're a general practitioner. I come into your office. Do you run the test? Is there something that tips you off? I'm quite certain we're in Sumter, South Carolina, the stroke capital and the diabetes capital. Okay, what if you think me as your patient might be a diabetic? Obviously, you would refer to the specialty here, but what kind of tests do you run?
Well, trying to ascertain a good history, seeing what the risk factors are. A lot of patients who have multiple risk factors, for instance, a family history, obesity, concomitant hypertension, inactivity. So those patients will get screened on a regular basis, screened with fasting glucoses, which is probably the best test for screening. If a fasting glucose is abnormal, then we perform a test called a hemoglobin A1C. But really more to your question is, again, a lot of these patients are asymptomatic. So sometimes it's just picked up either subtly with symptoms or just picked up randomly on blood work that may be done for some other reason.
So now the referral comes to Dr. Lily Vivat's office. And if we, a very interesting childhood diabetes, which is what you specialize in. Is that right, doctor?
Yes.
Explain that. Is that something that we're born with? Is that something that comes on when we talk about childhood? Are we talking about 5, 8, 13? When does childhood diabetes, which is type 1?
Well, unfortunately, that's very good because it's changing as we speak. Traditionally, in terms of diabetes, it used to be known as juvenile diabetes traditionally, which is what most people refer to as type 1 diabetes versus type 2. Most individuals out there have type 2 diabetes, which is the most common. There's a very big difference between the both of them. Type 1 diabetes, yes, it's mostly in children. Believe it or not, it could be at any age. 12 months of age.
Can I be born with it?
There are some congenital diabetes syndromes, mostly genetic, so you can be born with it. That's mostly genetic. The acquiring type 1 basically at any time, 12 months of age onward. So this is individuals that have a autoimmune reaction. So the body reacts to itself, attacks the pancreas where the insulin is made, and over time these individuals make absolutely no insulin. So they're 100% dependent on insulin. Wow. So these kids take multiple injections of insulin a day, or they're either on an insulin pump. The type 2 diabetes is traditionally what we know in adults, and that develops over time. Insulin resistance, as the doctor said here, we're talking about inactivity, overweight, family history. That develops certainly over time. Now, we just mentioned about South Carolina, capital of ABC.
Seems like it's the capital of a lot of things that aren't good.
So it used to be that type 2 was not seen in children, but it's becoming a lot more common. I'm having a lot of children that diagnosed at an early age of 8 or 9 years of age with type 2 diabetes, which is a consequence of what we're going to be talking about today. Insulin resistance, the foods that we're eating, the inactivity, and again, the family history. Mostly preventable. So I think that's one of the keys, and that's one of the beauties of the fair that we're going to have today.
How about reversible?
Mostly, that's what I'm trying to say.
So it can be. I can be diabetic, and then if I change habits and exercise and such, possibly reverse it.
I think that the reason why they changed the name of juvenile versus adult versus this and that is because most individuals with type 2 diabetes, eventually their pancreas is not making enough insulin. They eventually have to go on insulin therapy. When you're there, that's most likely not reversible. The
good news is actually type 2 diabetes can be prevented. Exactly. Because especially if you know that you have pre-diabetes. Now, what is pre-diabetes? The CDC had done some survey. Currently, in the United States, we have 86 million people who have pre-diabetes. And it's a very scary number because they estimated within the next 5 years, if those people do nothing, half of those 86 million people will become type 2 diabetic. Whoa, that's really high. And so now what is a pre-diabetes? Is that a borderline? No, it is not. Pre-diabetes is an entity where actually it's a pre-warned, but in fact, people with pre-diabetes have much higher cardiovascular disease than people who truly have no pre-diabetes. So therefore, it's not something that we take it lightly. People who have pre-diabetes, I myself have pre-diabetes. I have to do something to prevent diabetes. Otherwise, I will end up with complications.
He is Dr. Lily Vivat, and we are Medical Forum, and we are getting educated today. As we come up on our break, I want to again thank Bynum Insurance for all they do. and we'll be right back, and we're going to talk about the fair. And again, today, happy November 14th, World Diabetes Day, and we'll be right back.
We'll be back with Medical Forum, presented by At Your Service Home Care on Sumter's home for news, talk, and sports, WDXY 1240 AM and 105.9 FM.
The doctor will see you now.
Are you new to Sumter or been here a while and in need of a new family health care provider? Look no further than the excellent care provided by the physicians and staff at Carolina Family Medicine. Carolina Family Medicine includes Dr. Philip Jansen and Dr. Tracy Ridgel, who both specialize in family medicine. And they're here to take care of you and your family, now accepting new patients. So call them today to schedule your appointment at 774-7425 or find out more at cfmsumter.com.
The doctor will see you now.
Here's a good policy from Bynum Insurance and Auto Owners Insurance. When you buy home and car insurance, you'll receive a multi-policy discount. And when you buy life insurance, you'll get a special discount on your home and car insurance. Auto owners will save you money on all of the insurance you already have. Now that's good policy. This is Karen Schwartz with Bynum Insurance. Call me for all your insurance needs at 803-469-3030.
After my surgery, I heard my children discussing their fear for me to live alone. I wasn't ready to give up my home and freedom, so I called At Your Service Home Care, and now I have my own concierge. It's owned locally by medical professionals. They work with me to make sure that I recovered from my surgery. Now I can stay at home, and I have a new friend that I enjoy spending time with. If I need help around the house or have insurance or legal questions or just getting to my hairdresser, they help me with it all. Call At Your Service today for your free consultation, 607-9677.
Reliable Medical Equipment has been locally owned and operated since 1999 and provides a full range of medical equipment and services. Our accredited facility has a fully certified staff, and we are here to assist you with all your diabetic shoe, custom bracing, and prosthetic needs. We accept Medicare, Medicaid, TRICARE, and most private insurances. We're located at 246 Broad Street. Call 934-9212 or 435-9927 for our Manning location, which is at 37 West Rigby Street. Voted Best Prosthetic and Orthotic Business for 7 years.
This is Medical Forum, presented by At Your Service Home Care.
And we're back on this Saturday morning, November 14th, World Diabetes Day. We're here with Carolina Diabetes talking about the different forms of diabetes. When we left, I think Dr. Lil Vivat made a really interesting point, and I kind of hammer this to my patients. A lot of patients will come in with the notion of prediabetes, and I don't know if you've heard this in your practice, but a lot of them say, I'm borderline, right, doctor? I'm borderline. I have done everything in my power to get rid of that term. Yeah. I hate the term borderline. Mm-hmm. There's no borderline. Prediabetes is a disease. It's an entity. It's its own being. It's like being pregnant. You are or you aren't, right? Yes.
Correct.
And so I think when you convey that message to the patient, you're diagnosing them with a condition. There's a little bit more understanding. They understand the severity of it. And I can't tell you how many I've even seen on doctors' notes from years prior where borderline. They're not borderline. They're pre-diabetic. You've got the condition or you don't. There's criteria that says my glucose levels are this. You've got the condition. And I think increasing the awareness of that's really going to help improve treatment. Because that number is remarkable.
Well,
29,000.
29 million.
29 million. I'm sorry. 29 million have the condition.
Dr. Baez, people that might be just flipping the channel right now and miss the first segment, if you could, take prediabetes, type 1, type 2, take maybe 30 seconds on both, educate us, summarize for us. And obviously anyone who thinks that they might qualify from hearing this needs to come to 635 Westmark, especially if it's children. They need to see Dr. Baez. And you guys have so many physicians in there that can take care of them. But clarify that for us. What's pre?
I think that the most important, in terms of prediabetes, that's when your body's already struggling. Your body's struggling to make insulin, enough insulin to keep your blood sugars where they're supposed to be. There is some struggling. Patients with prediabetes, the management would be diet, exercise, eventually oral medications, eventually insulin. if it continues to progress. Type 1, completely, it's unpreventable. You cannot prevent type 1 diabetes. It's an autoimmune condition. Billions of dollars are spent around the world daily to try to find a prevention for this. Completely dependent on insulin, mostly children, but it can also occur at older ages. Type 2 diabetes is that full-blown pre-diabetes, I'm pregnant, not pregnant. You have a medical condition. You have a problem. If you don't take care of it right now, type 2 diabetes is what eventually is going to happen.
I'm going to ask you one more question on that, just because only Chris Marr would have an analogy of pregnancy and diabetes, which I think but for that is a common, actually, correlate. If I'm wrong, a lot of women that get pregnant also, at least short term, also become diabetic. Is that true?
Very important. Gestational diabetes, very true. And they actually screen for that in every single pregnancy.
Great call, Dr. Marr.
Thanks. I appreciate
it. All right. The Carolina Diabetes Fair. This is the 19th annual fair. Right, Amber?
That's correct.
All right. Dr. Lily Vivat. You're 19 years ago, talk us through this. Maybe 20 years ago, it took a year of planning. Where did we come up with this? This has been your baby now, and it is just. And I'm going to tell you, as someone that's attended it, I believe almost every year. We went Open Reliable Medical in 1998, so we're very, very close. Didn't quite catch the first couple. We've caught everyone ever since. It is a wonderful, educational. The lectures, the knowledge. The sponsors that you have that come in and take care of the patients, you got to be proud of your Envision 19 years ago, right?
Well, thank you. Yeah. Well, because we see that there's a need. There's such an explosion on the number of people that develop diabetes. And we see a lot of people suffer from diabetic complication. So therefore, there's a need to prevent this diabetes, prevent the complication. And as physicians, we see that we cannot do all the job. And we have not have enough physicians to really take care of everybody. So therefore, people need to take charge of themselves. They need to educate themselves. So we would provide the reason for that. We set up this public education so that people can understand, so they can take some of the knowledge home. They can start preventing the complication. They start learning how to take care of themselves, have a better health as well as better control of their diabetes so they would not have any complication. Now, years ago, we at South Carolina is really top of the list to have diabetes. We are the second in the nation. I believe now we dropped down to the third and the fourth now, which is very proud of it. That means we're doing something right. But it's still, we need to go down further because we still have too many people with diabetes.
Now, is that per capita or is that amount of people diagnosed?
Per capita.
Okay.
Correct. Yes.
Because we are a very small state. And so it's good to know at least per capita as opposed to, states that have an enormous amount more people than we do. But it just seems like it is they just feed off one another. Chris and I talk about it all the time, from obesity starting at a young age, and we all love our fried chicken, but diabetes and heart attack and stroke just seem to all go together. So, Diabetes Fair, Amber,
yes,
2 hours away. Mm-hmm. It's 12 o'clock today.
Yes, 12 o'clock
Saturday
today.
The 14th, World Diabetes Day. Mm-hmm. Where at? What do I got to do? Does it cost me to come? Do I have to have diabetes to come?
No.
Tell me the rules.
So it's absolutely free and anyone can come. So if you want to learn about diabetes, you know anyone that has diabetes or you have diabetes, it's a great event to attend. We'll have 6 different lectures going on various topics about diabetes and also kidneys. So this year will be the first year we also have the National Kidney Foundation coming to our fair. So we're very excited about that. Mm-hmm. And they'll be providing a lot of free health screenings. So with that, the first 100 people that come and do the free health screenings will get a $10 gift card to Walmart. So that's
good. Well, there's some incentive.
Mm-hmm. Mm-hmm.
Just don't go spend it on, chicken, fried chicken.
Soda or juice.
Yeah, juice.
Wilson Hall School?
Yes.
Okay. So plenty of parking, great setup. I think we've had it there for a long time.
Yes.
So that's for those who have come in the past. Starts at 12 o'clock.
Mm-hmm. 12
So you had plenty of time to get out, do whatever you need to do in the morning. And then 12 to 5 o'clock?
5, right.
Okay. And do the lectures start? Is there a certain time? So if I want to catch the lectures, do they go throughout the day?
They do. We have 2 going on at a time. So the first one's at 12:45, and then the next set is at 2 o'clock, and then the last set's at 3:15. And then after all of the lectures, we do a door prize giveaway. So the community has been generous enough to donate a lot of great door prizes for us to give away after.
She's Amber Studemeyer, don't call me Stoudemire, and she is the marketing person. You can call her that. She's very nice. She would tolerate that. From Carolina Diabetes, and we'll come back and learn more and more about what we can expect on November 14th, 2 hours from now. Thank you.
Back with more on Medical Forum, presented by At Your Service Home Care.
Reliable Medical Equipment has been locally owned and operated since 1999 and provides a full range of medical equipment and services. Our accredited facility has a fully certified staff, and we are here to assist you with all your diabetic shoe, custom bracing, and prosthetic needs. We accept Medicare, Medicaid, TRICARE, and most private insurances. We're located at 246 Broad Street. Call 934-9212 or 435-9927 for our Manning location, which is at 37 West Rigby Street. Voted Best Prosthetic and Orthotic Business for 7 years.
The doctor will see you now.
Are you new to Sumter or been here a while and in need of a new family health care provider? Look no further than the excellent care provided by the physicians and staff at Carolina Family Medicine. Carolina Family Medicine includes Dr. Philip Jansen and Dr. Tracy Ridgel, who both specialize in family medicine. And they're here to take care of you and your family, now accepting new patients. So call them today to schedule your appointment at 774-7425 or find out more at cfmsumter.com.
The doctor will see you now.
Here's a good policy from Bynum Insurance and Auto Owners Insurance. When your policy comes from us, it comes with something extra, a real person. Don't buy from an insurance company with an 800 number and a voicemail menu. Auto Owners Insurance operates exclusively through local independent agencies here to help you with all your insurance needs 24/7. Now that's a good policy. This is Ed Bynum with Bynum Insurance. Call me for all your insurance needs at 803-469-3030.
After my surgery, I heard my children discussing their fear for me to live alone. I wasn't ready to give up my home and freedom, so I called At Your Service Home Care, and now I have my own concierge. It's owned locally by medical professionals. They work with me to make sure that I recovered from my surgery. Now I can stay at home and I have a new friend that I enjoy spending time with. If I need help around the house or have insurance or legal questions or just getting to my hairdresser, they help me with it all. Call At Your Service today for your free consultation, 607-9677.
Now back to Medical Forum, presented by At Your Service Home Care on WDXY, 1240 AM and 105.9 FM.
And we are back. It's Medical Forum. I'm your host, Jeff Reed, with my co-host Chris Marr and our guest, Carolina Diabetes Kidney Center. We're talking about the fair that has been coming up, and we've learned so much about diabetes. Some things that just stick out for those of you that are joining us. 29 million people have diabetes and 9 million don't even know it, and how serious that is. We've learned about that there's pre-diabetes, that there's type 1, which affects children. Unfortunately, not billions coming in to research, but we just haven't quite gotten over the hump. And then type 2, which we see so much afflicted here in South Carolina, and it's a lot of times it's due to heredity. And within there's a lot of things that we can do that we put ourselves in a compromised position to also pick up the diagnosis. The Diabetes Fair, November 14th, today, in 2 hours. Less than that now, probably about an hour and 20 minutes. We're going to start on 520 Wilson Hall Road. Been fortunate to grab Amber, head of the marketing. Amber, you'd mentioned as we went to break that we're going to have as many as 6 different lectures that are going to go on. Tell people about it, and if you have the times, that would be fantastic. So if I'm plotting out my day of when I definitely don't want to miss one of these, and with the great staff that Dr. Lovivat, Dr. Shinda have put together, you don't want to miss these. And a lot of times these are going to be physicians that you currently see. So can you tell us about some of the topics and what might be covered then?
Right, and a lot of our providers will be talking, and they always include a little time at the end for questions and answers. So during the lectures, if you think of anything, jot it down and ask at the end. So at 12:45 to 1:45, we have Michaela Smith, who's our new dietitian to our practice, and she'll be talking about the benefits of mindful eating. And along with that, she's going to be making a pumpkin spice dip that everyone can try, and then she'll have the recipe as well to take home for the holidays. So that'll be something interesting and new for us.
I like that.
Mm-hmm.
What time is that?
12:45.
Right. Remind me to tell my wife. 12:45. Continue.
And at 12:45, we also have Dr. Gira, one of our endocrinologists, talking. She'll be talking about diabetes and obesity. And then we have 2 lectures at 2 o'clock. So one will be Dr. Shishinda. She's the vice president of Sumter Medical Specialists, and she will be talking with Tina Sylvester, who's at Fresenius Medical Care. And they'll be talking about Love Your Kidneys and talking about your kidneys and relating it to diabetes. And then I believe we have a patient that's going to be coming and kind of talking about their role and how they've done with managing diabetes and the kidney aspect as well. And then we also have our new infectious disease physician, Dr. Team Pett, talking about common infections and diabetes at 2 o'clock as well. So that should be something very interesting to hear. And then at 3:15, we have 2 more lectures. So we have Henry Well, who's with the National Kidney Foundation. He's going to be talking about your kidneys and you. So we have a lot of topics on kidneys this year, which is very interesting and new for us. And then we have Dr. Lala Vivat talking at 3:15 about diabetes and cancer connection. So,
while we have the expert here, Dr. Lily Vivat, what obviously we can't cover it all, but cancer and kidneys. And I'll share a personal note. My father died of kidney cancer, so this raises answers to me.
Why diabetes and cancer? And unfortunately, it's a fact that's happening. And now a lot of research are trying to identify what's went on, why people with diabetes have more cancer than people who does not have diabetes. And simply because these are whole thing about type 2 diabetes. With insulin resistant, it's a metabolic syndrome. There's a lot of abnormality in the hormones, especially our fat cell. A fat cell in our belly called visceral fat. There's our first enemy because it produces a lot of those bad hormones. And those bad hormones actually trigger some of those cells in our body, trigger some of the DNA causing mutation in some cell, end up causing diabetes, as well as cancer. So, and then the environment, the food that we ate, we have no idea what the food is causing the problem. And in fact, some of the food that promote insulin resistance, causing diabetes, as well as promoting the growth of cancer cells. So at the fair, we would talk about all this, and people should learn about what they can do to prevent diabetes as well as cancer. As you mentioned, so my father had type 2 diabetes. He also had cancer of the bladder. And we're going to talk about how in the thing that they discover in Germany, in Japan, certain type of food that we eat can actually minimize the risk of cancer.
Very interesting. And that hits home to me, obviously. Dr. Baez, we're going to talk about, through the lectures, childhood obesity. Dr. Maher and I have, at least on 3 or 4 occasions on our shows, talked about the necessity of education. We have the YMCA on, which is one of their tremendous causes about childhood obesity and such. Talk a little bit about that and what we'll hear.
Yes, it's very challenging, especially what Dr. Lila Vivat just said about the foods that we eat. It's a generational catastrophe, I would say. Most of the meals that we're having nowadays are highly processed, packaged, put them on the shelf. They last 3-5 years. That's what people are eating, canned. Very different than what our ancestors, as you would say, used to eat. Of course, there's always that big debate. It's not just the food, but that is certainly a big component of it. I mean, I think food didn't exist, we wouldn't be having half of this conversation. But it's a really big problem. And the other problem is that life is so quick. It's very easy to understand parents who just stick things in the microwave or buy the frozen because life is quick. And that's how you can take care of 1, 2, 3, 4, 5 kids. But it's very important to understand that the habits that they're being taught right now, that's what's going to stay with them forever and ever. That's what they're going to teach their kids. If I'm seeing them in the clinic at 6 years of age because they're obese and they have prediabetes, then you know what? I'm probably going to be seeing their kids at 3 or 4 years of age. So it really has to come, it has to be a family dynamic. These children can't do it alone. And in all honesty, even adults can't do it alone. It has to be a group effort.
It's interesting when we talked about the YMCA, which is a great ally to the community, and they spoke more to the inactivity, and I think those two go hand in hand. And, when I grew up, and we didn't have a remote, so we just had to get up and change to our 3 channels, right? So now kids have so abundance of between computer games. They don't go out and play football anymore. They put Madden in, and they play Peyton Manning and sit on the end of their eggs. Okay, me too. Thank you. But I think that's what we'll learn. And as we come back, we've got about one more segment, and I did want to talk about the nutritional part as we've touched on that, and what people can learn and what will be taught for the nutrition. And as we leave out, I want to thank Timmy, the foundation, great golf tournament. Support those Festival of Trees. It's a great marketing tool for any business out there, and it's a tremendous service they do to the hospital. Really livens up a hospital during a very trying time for people that have to spend the holidays in there. So we'll be back right after this.
Back with the latest in health and medical news on Medical Forum, presented by At Your Service Home Care, WDXY 1240 AM and 105.9 FM.
After my surgery, I heard my children discussing their fear for me to live alone. I wasn't ready to give up my home and freedom, so I called At Your Service Home Care. And now I have my own concierge. It's owned locally by medical professionals. They work with me to make sure that I recovered from my surgery. Now I can stay at home and I have a new friend that I enjoy spending time with. If I need help around the house or have insurance or legal questions or just getting to my hairdresser, they help me with it all. Call At Your Service today for your free consultation, 607-9677.
Reliable Medical Equipment has been locally owned and operated since 1999 and provides a full range of medical equipment and services. Our accredited facility has a fully certified staff, and we are here to assist you with all your diabetic shoe, custom bracing, and prosthetic needs. We accept Medicare, Medicaid, TRICARE, and most private insurances. We're located at 246 Broad Street. Call 934-9212 or 435-9927 for our Manning location, which is at 37 West Rigby Street. Voted Best Prosthetic and Orthotic Business for 7 years.
The doctor will see you now.
Are you new to Sumter or been here a while and in need of a new family health care provider? Look no further than the excellent care provided by the physicians and staff at Carolina Family Medicine. Carolina Family Medicine includes Dr. Philip Jansen and Dr. Tracy Ridgel, who both specialize in family medicine, and they're here to take care of you and your family, now accepting new patients. So call them today to schedule your appointment at 774-7425 or find out more at cfmsumter.com.
The doctor will see you now.
Here's a good policy from Bynum Insurance and Auto Owners Insurance. When your insurance policy comes from us, it comes with something extra, a real person. Don't buy from an insurance company with an 800 number and voicemail menu. Auto Owners Insurance operates exclusively through local independent agencies here to help you with all of your insurance needs 24/7. Now that's good policy. This is Bubba Johnston with Bynum Insurance. Call me for all your insurance needs at 803-469-3030.
This is Medical Forum, presented by At Your Service Home Care.
We're back for our final segment with Carolina Diabetes. Today, they got a big day ahead of them, of course, with their fair at Wilson Hall Road. Next week, we will have the police department here. and all on good terms, Chris. He did
on
nothing
good time,
wrong.
Nothing, yeah.
But it's a great program. It's called Checkmate Program. And what they do at this time of year, they help elderlies that might need help with smoke alarms or errands or just checking to make sure they're okay, make sure they have heat in the house. It's something that is a tremendous program. Captain Rourke has headed that up, and we'll learn a whole lot about that. And as we left, Amber, we were talking about all the great things that you're going to have from lectures, and nutrition was one. And as we left on nutrition, can you maybe give us a little bit, or Dr. Baez, either one of you talk about the nutrition aspect and what we might hear about that?
So Michaela Smith is our dietitian. She started with us about a year ago, and she does have classes as well as sees people individually and talks to them about the way to eat with diabetes, which Dr. Baez has mentioned earlier. A lot of people just kind of eat unhealthy because it's easy and it's quick. So it's important to learn. It's important to learn kind of what to eat and what not to eat. Dr. Baez, do you want to elaborate a little more?
Yes, certainly. I mean, as Ms. Amber said, Michaela does group sessions on dietary care for diabetes, obesity, and then she also does the one-on-one sessions. Very, very important. Key for care of diabetes and prevention of diabetes is nutrition.
Now, Dr. Lily Vivat, how many new physicians? It's very exciting seeing your practice continue to grow, especially at this stage. I mean, it was, as we talked about, a staple in the community. You mentioned Tina Sylvester with your dialysis, which is now we got two buildings now with Fresenius, and all the new expertise and the young talent like Dr. Baez, like Dr. Smith have come in. Tell us about some of the other physicians that have been recruited here.
Yes, we have grown quite a lot since we started. Initially, me and Dr. Sushina, my wife, started practice in 1981. Right. So just two of us. However, over the year, we see that there's a demand because South Carolina is a state that we still got a lot of disease. So because of the demand, we really feel like we need to bring in more manpower, more physician, more expertise, and now we have grown to we have 4 endocrinologists, including Dr. Baez and myself, and we have 6 nephrologists with kidney specialists, and we have 1 rheumatologist specialized in arthritis, and we have 1 infectious disease doctor, and then we have 2 primary care physicians. We know that the Colonial Family Practice has provided a tremendous load for primary care. But even that, many physicians in town, they're retired, so we don't have enough manpower to take care of people. So that's what the reason why our practice continue to grow.
And firsthand, I deal with, fortunately, deal with your practice at Reliable Medical Equipment. And what I like about your staff, they're nice, they're young, they're smart, they engage with people. There's not. To see, and Dr. Marr, your practice is a young practice, and that's not a knock at all against some of the older practice. It's just great to see young people out that are so excited to be in the medical community, and it's a very trying time, and that's a credit to your recruitment. Probably got about 3 or 4 minutes left in this segment. Carolina Diabetes Kidney Center on 635 West Mark. Of course, you have the building right beside it now.
Yes.
655, I think?
Yes.
Okay, I know from taking paperwork. Beautiful facility. I couldn't count. I'm not smart enough to count all the numbers you gave me, but we got about 12 physicians somewhere in that neighborhood touching on nephrology, endocrinology. I love children, taking care of them, Dr. Baez. We have a nutritionalist and general practitioner.
And general practitioner.
Yeah.
Yes. Mm-hmm.
And again, Amber, why don't you give us all one summary? In about an hour, we kick off, right? 12 o'clock.
Yes.
19th annual. Where? How much does it cost? Who's invited? Give us a rundown. People listening in want to know. And got some for the first 100, right? Is this like a concert? So if I get in line Festival seating, I get $10.
There is a line.
What are you
always
doing?
They're camping out.
Do you think we'll be late if we shoot out of here? I like Walmart like anybody else. What are you doing?
You have a new Walmart to spend it at.
Yeah, can that be used at Walmart?
Opening this week, earlier this week.
Wow.
So give us a rundown. Let everyone out there know of what's going on here at Wilson Hall.
Okay, so we start again later today at 12 o'clock at Wilson Hall School. Again, the event is completely free and open to the public, so we urge anyone to come out and learn about diabetes. Because again, today is World Diabetes Day, so it's all about diabetes awareness and prevention. So we have a lot of lectures, some great door prizes, a lot of vendors. Reliable Medical will be there. So,
well, there you go.
So a lot to learn and a lot to see and do. So it'll be a great event.
It is, and I can speak firsthand. Anyone who, if you think that you're not someone that should be there because you personally are not afflicted, there is probably no person, myself included, that does not have family. Or possibly I am afflicted. Now I'm finding out there's 9 million. I may be in that. Dr. Marr, have you done all the tests you've told me about?
I'm going to put you on the schedule this week.
Yes. I know I might even still be available with my behavior sometime in child diabetes. It's just a tremendous asset to the community. As you mentioned, Dr. Bias-Sumter is a haven for this. And it's a very serious disease that, as you mentioned, billions have gone into. And we're able to maintain it, it seems like. But the cure is probably, at least not in probably, maybe in yours and Miss Amber's young future. But, Dr. Marr, I know you see it in your practice.
Yeah. And again, it just to reiterate, it's preventable disease, type 2 diabetes, and there's so many things that can be done. Inactivity is tremendous. I think about, I drive through my neighborhood at night and how many kids are on electric scooters now that and I look at them and I'm thinking, really, you should be pedaling that scooter. There should be a bike. How many times I want to throw away the PlayStation at home and tell my kids to go outside and play and not. But it's really it's an evolution in our society, and we're much more sedentary than we were. Things are information's easy; it's at our fingertips, and just a change.
World Diabetes Today, celebrating since 2002. It's been my pleasure to have Dr. Lily Vivat, a very close friend of the community. He's done so many things. Him and his wife, Dr. Shishinda. My pleasure meeting you, Dr. Bias and Amber. Thank you so much, Dr. Marr. I will see you next week.
Have a good week,
and let's get in line. Get that $10 gift certificate. All right.
Thank you very much.
Everybody get out and support.
Yes.
You got it.
Looking forward to see y'all.
Have a great day.